Senator Hill called me this morning. She unfortunately had to rush home for something, and she is not going to be here at least this morning. So she called in her backup. So I'm glad to be able to fill in for a minute. Anyway, glad to have the Board of Dental Examiners here this morning to discuss their budget. I think we've got nursing board after that. So looking forward to hearing from y'all this morning.
Good morning.
Morning.
Thank you for being here this morning, and appreciate your accommodation for us from last week. And grateful that you're giving us a few minutes today. As you know, the Board of Dental Examiners is legislatively mandated to license and enforce the regulations in the profession of dentistry and dental hygiene in Mississippi. So to date, we have almost 7,500 licenses and permits that we issue, and so again, we just appreciate your time. I'll let Denise kind of speak to our numbers and our request for fiscal year 27, and I'll be glad to answer any questions. Thank you.
I find it fitting that Senator Hill couldn't be here because both of these boards were rescheduled from last week's hearing because they couldn't be here. So it's just been a real hard time scheduling, but we're glad that we can present in front of everybody. The dental board is very thankful for the appropriations they received in the last 2 years. They were able to accomplish a lot of long-term goals in 25 and finalize them in 26. They were able to implement a brand new database, and they went with one of the databases that a lot of the other small boards that are medical related went with, and so that was fully implemented in 26. They also had rules and regulations that changed over the last couple of years where they had sedation permits, and anybody that was a dentist that had a sedation license needed to have their facilities inspected. And so that the rules say that it has to be from somebody who is licensed with a sedation license. And so they actually had to go out for contract to be able to get that done. And so all of those have been completed. So as they looked at their operations, they decided that since those things were accomplished, that they could really have about $80,000 in savings. So they put in their request to reflect that as well. But then we know there's some changes with House Bill 1491. The ITS told us last year that there would be a charge to the agency for that, and the dental board was going to be charged $29,000. So we were going to take that out of that $80,000 and just use that savings to pay for that. Now, we understand that there may be some different legislation now that the agencies may not be asked to fund that themselves, and that the funding may now go back to ITS. So that could potentially not be needed in the request. That was $29,000. So after looking at all their cost savings and what they needed, really the only thing that they're asking for is staff increases. They would like to give an overall 3% progression for all of the staff, and that would cost $20,539. And we're asking that just be added to the recommended salary line item, which was $7,015,185. The board is fully staffed, and there's no need for vacancy funding in FY27's appropriation. And then I just want to talk a minute about the revenue. The revenue comes from dentists, dental hygienists, and permitting of radiologists. And the agency has changed its fee structure to make sure that it can sustain its budget over time. And it has increased the revenue, and that revenue will continue to increase in the future years. And that's the presentation.
Thank you all. I wanted to ask you about I didn't realize that the permitting for radiologists was included. I maybe missed that in years past, but is that any radiologist, or is that just dental radiologists? Is there a separate category there?
So they're not radiologists per se. They're dental assistants who have taken a seminar to be able to do x-rays within the dental practice. And so Mississippi doesn't license dental assistants, but we do issue those permits. And we have about 4,500 of those permits that we issue.
Is that
we
the same,
oversee.
is it the same fee as what the dentist and the hygienist pay?
Oh, no.
A lot lower?
It's a lot lower.
Yeah,
It's
that's what I figured.
$60 for the 2-year renewal cycle.
And
So it's $30 a year.
What's the dental and the hygienist permitting,
So for
annual fee?
dentist, the biannual, so the 2-year renewal is $400 for the dental license. Hygienist, that it is $200.
Okay.
And then if the dentist has a specialty license and sedation permit, there's additional renewals for that as well.
Just go back to, and whether it's Denny or Denise, who y'all go back to the database. I remember that was utilized. I can't remember who all was utilizing that
Right.
database.
So medical, nursing, and pharmacy
Okay.
use the same.
And is that working well for?
It is.
Is that the consensus? I mean, we got nursing up next, but is that the consensus that database improvements they're going well?
It is, it has gone, there were a few bumps initially, as it would be with any transition, but it's working smoothly. We just went through our first dental renewal cycle in that system. And I've received, when you have dentists giving compliments about the ease of the renewal process, something's been done correctly. So.
Good. All right. Great. Committee members, do you have questions? Senator Dupree, you're recognized for a question.
Thank you. The radiologist and the dentist, the hygienist and the dentist, are they all 2-year licensed?
Everything's, yes. So dentists renew in odd number years, and hygienist and the radiology permit holders renew in the even numbered years. So
And so every year you have someone renewing?
that's right.
Okay. And of those people that you renew is some 7,200? Is that?
It's closer to 7,500, I
Closer
think,
to
right now.
So
And
about half of those renew every year?
that's right. Well, there's 1,700 dentists, and then the rest of that number would be in the opposite year.
Okay.
But the renewal fees are less than the dentist, so it still balances out to be about the same
About
as
the
far as
same.
revenue
Okay.
year over year.
And the radiologists, they don't read the scan,
Oh, no.
anything like that?
They're just able to take the radiographs.
2-year licensure or 1-year licensure?
It's a 2-year.
2-year.
Yeah.
Okay.
Yes, sir.
Okay. Thank you.
Thank you, Senator Dupree. Senator Frazier, you came in late. Any questions for Board of Dental Examiners? You good? Okay, Senator Boyd, you recognize.
Thank you. I'm new to this committee, and so just I'm trying to get a grasp of just a couple of things here. How, do y'all have continuing education hours? What are those, and are they required every 2 years, every 1 year? Can you explain that to me?
That's a great question. The board's regulation changed in November 2024 after the OLRC had approved it. And so what we're doing now, and it started this year, and actually we're doing a CE audit this month. So we are auditing the whichever group most recently renewed in February of that year. The next year we're doing the audit. So right now we're doing the audit of dentists. So it's a 2-year period from January 1st, 2024 through December 31st of 2025. They're required to have 40 continuing education hours and every 2 years. There's some specific things that they're also, if they have a DEA permit, they have to have 3 hours related to the prescribing of opioids. And if they hold a sedation permit, there's a certain 8 hours that they're required to have as well within that 40. And then CPR also counts for towards the CE hours.
Okay, thank you.
Sure.
Thank you, Senator Boyd. Senator Dupree, you recognize for another question.
I guess I'm gonna use the same excuse Senator Boyd used. I'm new to the committee. You mentioned something about dentists using anesthesia, and I know every dentist does not use anesthesia.
Right.
And so you had to contract with someone to come and license them, or?
That's right. So of our 1,700 dentists, around 200 of them have an advanced sedation permit, either class 1, class 2, or class 3. Class 1 is going to be your oral maxillofacial surgeons, so they can do general anesthesia. Your class 2 will be moderate sedation. So those are primarily your pediatric dentists, your periodontists, those kinds those specialties. And then class 3 is minimal sedation. But to answer your question, each one of those permit holders, their facility had to also have an inspection based on the
Okay.
board regulations. So the regulation required for the initial inspection that 2 permit holders review every office. And so in a matter of 5 months, we did over 120 offices across the entire state, sending most of those cases, they were oral maxillofacial surgeons going out into these offices and doing these reviews.
So based on your criteria, 1, 2, or 3,
That's right.
1 would be the ones who give laughing gas.
Right.
Okay.
But no, 1 would be your general anesthesia. So that would be the highest level of sedation.
Okay, so 3 would be the laughing gas.
Right. Yes.
Okay. I call
And
it
actually,
laughing gas.
if a dentist is just using the laughing gas, they're not required to have a permit.
And,
No, not a sedation permit, not just for that.
okay.
Um,
Thank you, sir.
Sure.
Thank you, Senator Dupree. Okay, if no further questions, thank y'all. And Denise, thank y'all for being here and
I appreciate your time.
Let us know.
Thank you.
Yeah, let us know if you have any other questions over the next week or two before we start rolling on appropriations budgets.
All right.
Okay,
Thanks, Senator.
thanks a bunch. All right, Phyllis, you ready to come on up? Thank you so much. All right. Hey, what you doing? All right, ladies, whenever y'all are ready.
Good morning,
Good morning.
Mr. Chairman, members of the committee. Thank you for this opportunity to present before you, and thank you for the accommodation with the weather last week. And we're still praying for the northern part of our state and the Delta area. I know timing is of the essence. It's important to you. It's important to each and every person in this room. So we want to come before you this morning with a couple of things that we want you all to be aware of. As you are aware, we are the largest regulatory agency in the state of Mississippi. We license LPNs, RNs, and APRNs, and we have approximately 80,000 licenses that we are responsible for regulating. And our 13-member board, appointed by the governor, oversees that regulatory process. We're coming before you today to talk about workforce issues and staffing concerns. And we are very appreciative of your support, the legislative support in helping fund our workforce, our nursing workforce, and especially through our Office of Nursing Workforce. And because of your generosity, we have been able to award grants to nursing programs and scholarships to nursing students in our state. More than $4 million in grants were awarded to nursing programs from 2019 to 2024. And it made it possible for scholarships to be provided to nursing students of over 7,304 scholarships awarded statewide during that period. We saw that number increase in 2025 to 8,508 students. And those scholarship recipients were required to work in the state of Mississippi for a set period after graduation, thus enhancing the workforce in the state of Mississippi and strengthening that workforce. So we are very grateful to the legislature for your ongoing commitment to supporting nursing education and addressing the healthcare needs of our communities. Now, I want to extend some meaningful support to our dedicated board staff. Our agency continues to face significant challenges, being the largest regulatory agency in the state, with recruitment and retention, largely due to salary limitations. And this affects our candidates that are talented and skilled in areas that are needed at the Board of Nursing. Between October and December, we posted 10 positions for recruitment, and we were only able to fill 2. For example, the salary offered for the advanced practice nurse position at the board was less than half the typical salary these professionals can earn elsewhere. And our nursing positions, we have some nursing positions there, were outrightly declined by nurses due to the salary offers by the state. Our top priority is recruiting and retaining a strong, capable team. Now, don't get me wrong. Even though we are having difficulty recruiting, I have an excellent staff at the Board of Nursing, and we work extremely hard to ensure that the safety of the citizens of this state are regulated. The legislative budget recommendation is to eliminate 5 positions from our head count. If these positions and their associated funding are not restored, our agency will face significant challenges in meeting the growing demands of regulating and supporting the state's workforce in nursing. We are complaint-driven. We get complaints every day. And in addition to restoring the deleted positions, the board is requesting increase in its salaries and contractual services over our FY26 appropriated amounts. The ability, to retain employees by awarding salary progressions is hampered when vacancies must be filled prior to awarding salary increases. So the board is seeking $112,466 in the salary budget to address these needs. And we are requesting to award the maximum 7% salary progression for all nursing positions. In addition, we are requesting to award an average 4% salary increase for non-executive staff members. And finally, we are requesting a 2% salary increase for the executive staff members. We are requesting flexibility in awarding progressions while there are vacant positions in order to retain staff without creating more vacancies. And in our contractual budget, we are requesting the FY27 contractual budget includes increases in 2 line items, both which are outside the control of the board. First, with the passage of House Bill 1491, ITS has estimated that it will increase its annual fees to the board by $49,486. And there will be a one-time charge of $3,000 for data migration in FY27. This $53,486 has been added to our technology budget request in FY27. During the 25 session, the legislature assigned the military medics program to the Board of Nursing, and there was no additional budget authority provided to address the $21,355 startup cost, which will occur in FY26 and be absorbed in our budget without requesting deficit spending authority. We are requesting an additional $13,800 for FY27 to fund that ongoing subscription fee. We have enough funding to cover our budget request. In addition to that, the human trafficking bill, which has been proposed by the AG's office, will require the Board of Nursing to need an additional $10,000 if that bill is passed in order to be implemented. Therefore, we are asking for coverage of that in our budget as well. And with that, I yield for any questions that you may have.
Thank you. I know we did raises in FY25. We didn't nobody had raises last year. What is that? Obviously you're still behind, is what you're saying. You're still behind on pay is what you feel like, because the raises from FY25, did that help stem the tide a little bit when they got the raises in the previous year?
It definitely helped. The staff was very appreciative of that, but we're still less than competitive with the private sector. And especially in hiring positions for the skills that are needed at the Board of Nursing.
Y'all losing some to other, are you losing some to other agencies from time to time? Any of your staff, is it getting, are they getting pulled away to any other agencies?
State agencies or
Yeah,
agencies outside?
State agencies.
I don't think so.
Not too much,
I don't
okay.
think we've had time to go to the private sector,
Yeah,
but not to the state.
Okay, all right, thank y'all. Questions, committee members? Senator Boyd, you're recognized for a question.
You probably heard me say, I'm neat. Kind of tell me just a little bit, how many, how you said you deal with discipline a lot. How many staff members are dedicated to dealing with discipline issues and hearings and things like that. Y'all have 35 employees, I see. Kind of give me just a quick overview of what those 35 employees do.
Okay, so we have a licensure division, which is responsible for licensing all of the nurses that come in, and that's an APRN and RN and PN nursing division, division for licensure. We have an investigatory division, Department of Investigations, and that division primarily is responsible for the disciplinary component of investigating any complaints that come in. We have approximately, and I always get this, my chief of staff may have to help me with the numbers, but we have approximately 6 to 7 investigators in the area. We have a criminal background division that does the fingerprinting, and we have 3 individuals assigned to that area for a total of 9 to 10 people in the investigatory process. We have a compliance division that looks at also those individuals that have been disciplined but have to be monitored for whatever reason. That compliance division is a staff of 1 at present, but we do have another a PN for that position. So that makes approximately 12 people that are geared toward that.
Yeah, and how many people are y'all monitoring for compliance just roughly at one time? I'm just trying to get a general picture.
We have right now 130 people that we're monitoring in compliance.
Okay. Okay. And typically, is this somebody who maybe has had a drug issue that you're monitoring? What's your typical person that you're trying to get into compliance?
So we have an MVP program that individuals that have substance use disorder or severe psychiatric conditions, that division monitors. We have approximately 30 that are in that division now, and those people are allowed to continue to work as long as they're in the MMVP, and that's a confidential program, but they can continue to work. In the compliance division, the rest of those individuals have been disciplined, but they have stipulations on their discipline that they have to complete. And that's what the compliance division monitors to ensure that they are carrying out whatever the board order has put in there for them to complete in order to come back and get their license restored.
Okay. All right. Thank you.
Thank you, Senator.
And we do have 2 attorneys. We could use another one if you all would like.
I may be for hire soon. I don't know. Thank you. Thank you, Senator Boyd. Senator Dupree, you have a question?
Yes, sir, Mr. Chairman. So I'm interested in the $4 million in grants and 8,500 students that you were to get in the scholarship program. And you had a number of years they had to remain because they accepted the grant or scholarship, right? Yeah. So how many years is that?
1 to 2 years, based on the number of years that the scholarship monies that they receive.
1 to 2 years.
Yes.
So do you track after those required years, how many actually remain? I mean, we talk about a scarcity or the lack of having a number of teachers and medical staff, and also the brain drain. I hear that everywhere I go. So do you track after their regulatory years that they have to stay? How many actually stay after that time, or do they move on as well?
We are in the process of collecting data. Our Office of Nursing and Workforce, that's one of the things that we looked at to begin to track to see how many actually stay after their commitment. In some of the areas, especially in rural areas, nurses come from those areas, they stay in those areas, that's home. But then you have the opportunity in the metro areas, and a lot of people like to go to the metro areas, and then you have travel nursing. Once they complete that requirement, they may travel, but we also have travel nurses from other states come here as well to work. But we are in the process of developing a data bank to try and monitor that.
I would be interested to know, we do the same with police officers and firemen when we allow them to have scholarship. I'd be interested to know if we're really spending a number well. I mean, getting them educated, they stay here for a couple of years, but are we really do we have incentives to keep them here or something after their required stay?
Okay.
Okay.
Thank you.
Thank you, Mr. Chair.
Thank you, Senator Dupree. Senator DeBar.
Thank you, Mr. Chairman. I'm looking at page 3 of your handout on the revenues versus expenses. It looks like that kind of alternates every year, but like last year, FY25, you had about $4 million What's the revenue, I guess, where's that money go? Do you still have it or is that expended somehow?
We do still have the revenue. We have about 8.9 million in cash right now, but those alternating years, we have about 13,000 LPNs that renew. And then the following year, we have about 46 to 50,000 RNs renew. So we still need that difference in monies to offset the 13,000 that renews.
Okay, so what you're saying is the extra revenue from F-125 helps you get through the next fiscal year.
Correct.
So that's why you need to keep that money presently. Okay. So they renew their license every 2 years? Is that what it is? Is that what it is? Okay. And that's for all the nurses?
The nurse.
Okay.
LPNs are odd years, RNs are even years.
And that includes the APRNs?
APRN, yes.
Okay,
Yes, sir.
all right. Thank you. Thank you, Mr. Chairman.
Thank you, Senator Barr. Ladies, what's your current head count? I know you got 40 on your request, but it looked like it was 35 at the LBR snapshot. Where are you right now?
So field positions, 23, current head count 39.
Okay. All right. Thank you. Thank you, ladies, for being here, and we will be with you, as I told the Board of Dental Examiners, certainly over the next week or two. If y'all have anything that comes up, let us know. All right.
Thank you.
Good to see y'all.